Sure you've heard, we're back up here in Richmond, and actually we just got off the floor of the House of Delegates talking about Medicaid, including the Virginia Healthcare Independence Act. I think one of my colleagues said it best when he spoke about Medicaid expansion, that our current Medicaid system is like a ship with some holes in it. The Virginia Healthcare Independence Act isn't meant to expand Medicaid, it's not even meant to plug the holes. It's meant to be a whole new ship. Essentially, it's a top-down reform of our Medicaid system. During the debate, some of my colleagues pointed out some potential shortfalls and had some questions that still need to be answered, and as expected in the end, it didn't garner enough votes to move forward. However, it prompted some great discussion, and I really appreciate the speaker allowing it to have such a robust debate on the floor of the House of Delegates. With that, I hope you find the following segments helpful, and down the road, I hope we find some of these reforms in some future solutions. The biggest problem with our Medicaid system is it's unsustainable. There's no way we can continue the cost curves that exist in our Medicaid system in Virginia. You know, just over the last 30 years, the cost of Medicaid has gone up over 1,600%. And right now, Medicaid accounts for over 22% of our state budget. Uninsured Virginians alone account for over $1.2 billion over the last 10 years, and some estimates show as much as 10% of your personal insurance premiums go to cover uninsured Virginians. This is a system that we can't expand, that we can't even continue using in the status quo because it'll bankrupt the Commonwealth, which is why we have to move forward and reform the system. We can't expand it, and completely, to be honest with you, we can't even keep the system we've got. A huge problem with our current Medicaid system that I didn't mention in the last segment because it truly is a huge problem in and of itself, and that's the Medicaid cliff. See, the present system is created where it actually disincents people from getting off Medicaid. It truly holds them captive. It's a system where people find themselves turning down a raise or a promotion at work because the value of the benefits they would lose far exceeds the value that that opportunity would give them. We have to create reforms that get rid of that Medicaid cliff, that get rid of the disincentives for people to leave the system and help them walk off the system. And that's one of the reforms the Virginia Healthcare Independence Act provides. The Virginia Healthcare Independence Act isn't Medicaid expansion. Actually, it's quite the opposite. Expansion is what we've been doing for decades. Remember, Medicaid costs have been soaring to the extent that it's grown over 1,600% in the last 30 years. Year over year, the number of recipients inside the program has increased. The cost to the Commonwealth of Virginia and its taxpayers has increased. What the Virginia Healthcare Independence Act does is puts reforms in place that decreases the cost curve compared to where it's going and decreases the number of recipients that will be in the system compared to the curve and where that's hitting. And through these reforms, we actually drive down those numbers compared to where the status quo is going. The Virginia Healthcare Independence Act is essentially 5 reforms. The first reform provides coverage for those in the healthcare gap. The healthcare gap is this ridiculous position that was created where a person finds themselves making too much income now for Medicaid, but too little income for support and subsidy inside the federal exchange. So these are the people that end up going to the ER. We have to subsidize them through our taxpayer dollars or those additional premium costs that we have on our personal insurance, because they don't have access to traditional healthcare support. The second reform is creating an expectation of personal responsibility. Through work search, and community service requirements, it sets that expectation for many that this is meant to be temporary assistance, not permanent assistance. The third reform assists Medicaid recipients to walk off Medicaid via the Virginia HIP program. The HIP program is a program that helps Medicaid recipients leave Medicaid by going onto their employer-sponsored health care and decreasing the cost to Virginia taxpayers and really bending that cost curve of Medicaid for the Commonwealth of Virginia. The fourth reform removes that Medicaid cliff. Remember, the Medicaid cliff is the situation that exists where people can't take that raise or that promotion because the value of the benefits they lose far exceeds the value of that opportunity. This smooths out that transition and basically gets rid of that disincentive and will allow people to walk themselves off the Medicaid program. And the fifth and last reform eliminates service excesses, like taxi services for non-emergency transport. That's essentially the Virginia Healthcare Act. The inspiration for this legislation came from Governor Allen's 1995 welfare reform legislation. It was there he created the blueprint for need-based service reform. In that welfare legislation, he emphasized personal responsibility, private sector service delivery, created a path for personal independence, and emphasized the elimination of service excesses. And he did it by providing the services that people needed to work themselves off the system. Additional child care, additional access to regional transportation, and additional training and education. For those able-bodied, able-minded recipients, they realized that these services were meant to be temporary and not permanent. And in the first 2 years of this reform, welfare benefits decreased by over $101 million, saving Virginia taxpayers over $57 million. And that's the same blueprint we're using for the Virginia Healthcare Independence Act, the system where we can put in place reforms that allow able-bodied, able-minded recipients to find that personal path to independence and create a system where these services are meant to be temporary and not permanent. People have tried to compare the Virginia Healthcare Independence Act to some other state solutions, but in all honesty, this is nothing like any other state solution. They don't have a HIP program, and they don't eliminate the Medicaid cliff, which is what allows us to actually start to shrink the system, bend the Medicaid cost curve, and make Medicaid sustainable again for generations to come. The first thing we want to keep in mind is that these are new taxes and fees implemented by the federal government on Virginians and Virginian companies to provide this federal funding. I'd rather not have these taxes and fees, but to the extent that I didn't get a vote on that and they're there, we need to put those funds to good use. Those federal funds provide reimbursement to the Commonwealth, and at 100% reimbursement right now, it equals $2 billion a year. DMAS, the Department of Medical Assistance Services, estimates the savings with the Virginia Healthcare Independence Act to be about $150 million a year to the Commonwealth of Virginia. So the first answer to what happens if the federal government doesn't live up to the obligations that is put in front of us is that if these savings were held in the Virginia Health Reform and Innovation Fund at a reasonable rate of return, there's a chance it could still provide sustainability even with an unanticipated federal funding cut. The second answer is if it's not sustainable given those cuts. There are people that are concerned that there's no political will or may not be the political will to terminate these reforms. But the Virginia Healthcare Independence Act actually terminates all these reforms automatically upon funding levels decreasing less than the anticipated amount that we have in outlying years. The third answer is that even if this program is terminated years down the road, it could have already bent the Medicaid cost curve substantially, and that bend in the cost curve can still continue in perpetuity down the road and would supply significant savings over what the status quo will be providing on its cost curve. And lastly, and not an economic, but even a short time under these reforms will significantly change the life of some Virginians and their families. So can we actually implement these reforms? I guess that's the $2 billion question, and I don't know the answer to that. You see, these reforms haven't been approved by the federal government to draw down these federal funds. We have to ask for waivers to be able to implement these reforms with the federal funds. But, you know, as far as I'm concerned, our job up here in the General Assembly is to find a way to fix the Medicaid health care coverage gap, and do so in a manner that helps people walk off Medicaid, bends the cost curve, provides sustainability for this program for generations to come, and do it in a manner that protects the taxpayers of the Commonwealth. And that's what the Virginia Healthcare Independence Act does. If the federal government doesn't want to approve these waivers and they want true traditional Medicaid expansion, well, someone else can deal with that legislation. I think this is the proper legislation for the Commonwealth that fixes these issues, allows people to walk off Medicaid, and protects the taxpayers. And that's the Virginia Healthcare Independence Act. It's not Medicaid expansion. The present system is unsustainable and requires these reforms. Just like when Governor Allen in 1995 reformed welfare and saved $101 million over the following 2 years in welfare benefits, we can put that same blueprint in place here with regards to Medicaid and put in personal responsibility, create that path to independence, utilizing the HIP program and eliminating the Medicaid cliff to allow people to walk off Medicaid and to eliminate those service excesses. And even if federal funds fall below expectation, the Commonwealth still ends up in a better place than where we're heading today with the present system. Remember, in status quo, it's not an option. It's just a chance to bring forward reforms to save our Medicaid system and create sustainability with it and talk about how we overcome these Medicaid challenges that we have today. As always, I really appreciate your time, and if you have any questions or thoughts or ideas of your own, please give me a ring.